Hello. We're often asked, about the coronavirus situation in Brisbane and how Australia has managed to keep the coronavirus numbers down so well. And people ask us why we don't wear masks and what sort of restrictions in place and why some towns lock down and others don't. So in this video, we're going to move around to different spots around the city and we're going to answer some of those questions for you. So one of the things they did was the Queensland government introduced a Queensland check-in app, and whenever we go to businesses like this one, we scan our QR code and we're all checked in to go.
At the moment, there's only one case of COVID in Queensland, and that's already in a hotel quarantine. We've had 1,589 cases in Queensland since last year, February last year, but there's no cases of community transmission in Queensland at all at the moment.
One thing, we're really lucky because we don't have to wear masks. Well, there is a national directive where we do have to wear masks in any airport terminal or on any aeroplane, domestic or international. But apart from that, they're not compulsory. Most people will have a mask on them though, in case they find themselves in a crowded situation and that they can't remove themselves quickly, just to minimise the risk. As an extra measure, a lot of our traffic lights have been changed so that people don't press a button anymore. It just happens automatically. And in Queensland, they've done more than 2.5 million tests for the coronavirus, and 170,000 people in our Queensland population have been vaccinated so far.
Including me.
Yeah, including Paul.
I had the AstraZeneca vaccination about 2 weeks ago.
Yeah, so Australia has been very slow, and maybe it's because our government hasn't seen that there's
an urgent need. Yeah,
an urgent need compared to other countries. So We've been a lot slower than other people in other countries in rolling it out, haven't we?
Yeah, that's right.
So we're up to 170,000 for Queensland, but other states like Victoria have massive vaccination centres and they're able to vaccinate a lot of people at once. In Brisbane, even in the restaurants, everybody has to keep 1.5 metres distance, and the restaurants have to accommodate this. So if you look in the restaurant just here, every second table is empty. So they're making sure that the 1.5 metre distance rule is enforced, and if they don't, they could face a fine from the government. There's socially distanced reminders in public places too. And we should mention that all COVID testing and vaccinations are free. Earlier on in the pandemic, a lot of office workers and students stayed at home. But at this point in time, most office workers have gone back to the office and students are returning to their campuses. I think contact tracing was a big thing that contributed to the success of controlling the virus, not only in Queensland but also in the rest of Australia. If there's a locally transmitted case of the coronavirus, the local health officials look at all the venues that person has visited in the previous days. They contact all the people they've been in contact with. Those people are asked to quarantine at home and also to be immediately tested. The QR code, the scanning at different venues, that really helps with the contact tracing as well. And I think that that's probably the way they've been able to jump on top of it so quickly. So why do you think people around the world would be looking at Australia thinking, wow, everything's so normal. People are walking around, they're jogging, they're going to work. Why do you think that's the case?
Well, because
the way that mainly state governments have controlled any outbreaks so well.
Closing the Australian borders has been a big factor, hasn't it?
Oh, absolutely.
Yeah.
It's been closed since mid-March last year.
Yeah.
Yeah.
So anybody that returns home to Australia has to go into compulsory quarantine now.
Yep.
When they initially introduced a quarantine program, people returning from overseas could quarantine at home.
Yeah.
Then they found some people weren't doing that.
Yeah.
So they introduced the hotel quarantine system, and the bill for that was paid by the various state governments, depending on where you flew into. So we flew into Sydney from Vietnam, and the hotel quarantine system was fairly new then, wasn't it?
Yeah, very.
And we didn't have to pay anything.
Yeah.
So that was really good. We had all our accommodation and all our food and all our health expenses, if
Yep.
we had any.
Yep.
They were all covered.
Yep.
That was great. Then they worked out, as this kept prolonging, it was working out to be a very expensive program for the state governments. So they've introduced a charge for that. And I think it can vary a little bit, I think, between states. So people arriving in Australia now, they are charged approximately $3,000 a person, aren't they?
That's right.
Maybe a bit cheaper for families or children.
Well, it is. It's a reduction for each child, but it's still expensive.
Yeah, so that's expensive. And it's very difficult for Australians now to leave Australia, isn't it?
Well, to leave, you have to get permission, and only if you've got like a family situation overseas that you need to get to, or a business that you need to go overseas for.
You have to apply for an exemption, don't you?
Yeah, that's right.
And those things have definitely made a difference.
Yeah.
But it's been devastating to certain industries as well.
That's right.
You know, the universities especially.
Yeah.
You know, we have so many international students in Australia that come to Australia to study, but in Brisbane especially, we walk around QUT campus and UQ, and the international students, you can really notice they're not there.
That's right.
Yeah.
And it was a vibrant part of our society when the students were here, but it's so quiet now. It's very noticeable.
Yeah, it's really sad. They really do bring something to the city, don't they? They really bring like this energy and this enthusiasm.
Yeah.
And it's great to see them around studying and shopping, and
That's right.
you know, we have people who watch our videos who have enrolled to study in Australian universities.
Yeah.
And they may have even started their studies from overseas, but they're not getting the real Australian experience, you know?
That's right.
And it's nothing to study online, as you can imagine, it's nothing like studying in a classroom. And to be studying and living in a different country on the other side of the world is a fantastic experience. And it's really sad that those students are missing out on that, isn't it?
Yeah, it is. It's really
I hope they come to some kind of arrangement where if the students are vaccinated, that they can come.
Yeah,
you know, maybe
exactly.
something like that would be great.
Well, they
Really
say
good.
they're working on a plan, but no one knows what it is at this stage, so we just have to wait and see.
Yeah, and so that's all we can do.
Yep.
So the big question is, when do you think things will get back to normal?
Well, that's the question everyone asks. A lot of Australians are comfortable with the way it is at the moment because they feel safe, but really it's got to come a time where Australia will have to start opening up its borders again. And that's some of the health experts are saying it's inevitable that COVID will get back into Australia, but the government said, well, we want to get everyone, or as close as possible to everyone, vaccinated before they even contemplate doing that. And that's why many people are saying, well, they need to speed up the number of vaccinations that people are getting.
We hope this has been useful, giving you a bit of an idea on how things are. I mean, things are pretty normal here, and we're really lucky. And we don't forget that because we know that that's not the case in so many places.
Yeah, absolutely. And even countries that have kept under control, there's some outbreaks now, like Singapore, for instance. So everyone, it's like eternal vigilance at the moment.
It is, This whole thing, as we all know, it's so fluid, and it can change at any moment. I mean, only a few months ago, Queensland locked down for a few days.
Well, Brisbane went into lockdown for 3 days.
Brisbane,
it wasn't that long ago. And other states have had other capital cities in Australia have had to do the same thing. So it's a constant threat, and but like Beth said, we're very lucky to be all living an almost normal life at the moment.
So we hope that wherever you are, that you're keeping safe.
Yeah.
And that, and we'd love to know,
Yeah.
what it's like where you are,
Yeah.
where you live. Do people wear masks? Can you go outside? Were you under lockdown for a prolonged period?
Yeah.
Are you working from home? We'd love to know. Please put it in the comments, because we're really interested to know what it's like in other countries as well.
Like we always say, we're thinking about everyone around the world,
We
because,
do,
some situations are worse than others. And we know in the UK, for example, they're starting to move out of lockdown. So, I think it's great for them as well.
Yeah, fantastic for them.
Yeah.
So take care.
Yeah, take care, everyone.
And we'll see you in our next video.
Okay, bye.
Bye.